Inside your chest and shoulder lies a slender bone that is far more powerful than it looks, the clavicle, or collarbone. It is the bridge that connects your upper limb to your trunk, the very first link between arm and body. Look closely. The clavicle isn't a straight rod. Its shaft bends in a graceful double curve, like an elongated capital S. The medial two-thirds bulge forward, convex anteriorly, while the lateral third swings the other way, concave anteriorly. This clever design increases its strength and resilience, allowing it to absorb and withstand shocks from the arm. At its sternal end, enlarged and triangular, the clavicle locks into the manubrium of the sternum, forming the sternoclavicular joint. At its acromial end, flattened and wide, it meets the acromion of the scapula at the acromioclavicular joint. Together, these joints act like pivots, giving the shoulder maximum freedom of motion. But the clavicle isn't just a strut, it's a movable crane. By holding the scapula away from the trunk, it suspends the free limb so your arm can move in almost every direction. When fixed in position after elevation, it even helps lift the ribs, powering deep inspiration. Hidden beneath the skin, the clavicle forms part of the bony border of the cervico-axillary canal, protecting the vital neurovascular bundle that supplies the arm. Every push, every fall, every sudden pull on your arm, the clavicle transmits these shocks safely to the axial skeleton. Unlike most long bones, the clavicle is unique. It has no medullary cavity. Instead, it is made of spongy trabecular bone wrapped in a shell of compact bone. It lies entirely subcutaneous, easy to feel along its length, making it a vital landmark for clinical procedures. The superior surface is smooth, lying just beneath the skin and platysma muscle. But the inferior surface is rough. An anchor, point for the strong ligaments that tether it to the first rib and suspend the scapula. Near its acromial end sits the conoid tubercle, where the conoid ligament, part of the coracoclavicular ligament, suspending the rest of the limb. Beside it lies the trapezoid line, securing the trapezoid ligament, the other half of the coracoclavicular complex. Further along the shaft, a subclavian groove anchors the subclavius muscle. While more medially, a rough oval impression marks the site of the costoclavicular ligament, binding clavicle to the first rib and limiting shoulder elevation. So the clavicle, though slender and fragile-looking, is a masterpiece of structure. A strut, a shock absorber, a shield, and a crane. Every time you raise your hand, breathe deeply, or reach out, this little bone silently powers the motion.